Let's see here. Can everybody hear me? Closer, I guess. I think it's working. Can you guys hear me all right? She's videoing me for some Instagram stuff here. Oh, cool. Getting the kids to bed right now, so might hear some Charlie noise in the background. He's almost so. Yep, this is Carlin, my wife, beautiful wife.
Hi. Can they hear us okay? Is it echoey?
I think so.
Because we changed the setting.
We're messing with our microphone, so if there's any issues, no trolling, but let us know.
Hi. Yeah, the background. We might have to close it when we get started, but Florida. All right, let me get this.
She's videoing me for some Instagram stuff. Uh-oh. So the audio is cutting out?
How is it right now? When you go closer?
I have it only so they can talk once a minute right now. So they can only type something once a minute.
Oh,
so
okay.
I might have to
Let me look at it on here.
wait for a response.
Let's let more people come and then we'll get going on stuff. I'm going to check it here.
Life is expensive. Quality tools don't.
It's cute.
A12 asks, hey doc, where do you find those bumps for back mobility? I think, are you asking about the stretching? A12. Okay. Hey doc, where do you find them? All right, sounds good.
Let me disappear a second.
So there's bumps in people's backs. You know, those are areas of restrictions, injuries, poor posture. So you can have, areas that are frozen that need to be loosened up from, an injury, from guarding, where you can have alignment so your person's head's forward or they're rounded forward and their muscles are tight. And that's part of what we're cleaning out when we adjust them, get them stretched, clean their spine out. Yes, this is my wife, Carlin. She does most of the filming, all the filming. Occasionally, sometimes my daughter filmed once. And
just when we need to film ourselves together.
Yeah,
our kids
I've had some kids film sometimes.
Our tripod.
Once.
Yeah, she did when Charlie was first born and I couldn't get there. So.
Yeah.
Yeah.
Okay. Awesome.
Hello, Natasha. Try to say people's names when you.
Yeah. Hello from Greece. It's awesome.
Hi.
Spyros. It's like Spyro the PlayStation. It's like the one video game she used to play. All right. Here we go. Do you want this closer?
No. It's okay. Hi, Angel. Glad to see you. Lisa. Oh, there's Lisa. Hi.
Hi, Lisa.
Lisa. Oh, there's Lisa. Hi.
Hi, Lisa.
Hi.
Hey.
We know you. Natasha. Hi from Indonesia. Cool. Hello. Oh, is it cutting out for other people? I just pulled it up on my phone and it wasn't cutting out. Can anyone else comment if it's cutting out?
Raise the gain a little bit. Maybe that'll help.
I don't know how to say your name. Eleni. Sorry. I don't know if it's cutting out for everybody. I'd have to go in there and watch it and see how you talk.
Good. Take your.
Okay, I'll be back.
See ya.
Maybe Samuel.
So yeah, percussion guns. it's just you're trying to increase circulation, right? So you're freeing up mobile areas that are frozen. Sometimes you got to be careful because they can, if you get too close to an injured area, they can move the injured area a little too much. So I can hear myself talking on my wife's phone over there. So yeah, you want to be careful with using, if it's too close to the injured area, that it moves the injured area too much. Otherwise, yeah, they're fine. They're usually not as deep as I'd like to go, so I use them kind of if the patient has difficulty with deep tissue work or the gua sha or deep adjustments. I just adjusted all of them about 5-10 minutes ago before I got on the stream. Everybody's got their evening adjustment. So yeah, they all got, even little Charlie. Little Charlie wasn't too excited about it, but usually by about 3 or 4, some kids are known to do better. I had one like 1-year-old that adjusted really easily. It was crazy. He was, he had older siblings that would get up on the table and they were adjusting easily, and then he kind of just watched his older siblings, and he knew that if he got adjusted, that he got a lollipop, and so he was happy about that. Vic Fox asks, can you help someone with slipped rib syndrome? So a lot of the ribs will go out of alignment because of posture. So it depends on which rib is out. The joints, this is what we use the word subluxation. Usually they're not, completely out of place. Usually it's the joint is swollen, which then displaces the rib a little bit. So if the posture is creating the swelling, which is moving the rib out of place, then you want to get rid of the reason for why the swelling's there, which is making the posture change. Sometimes the most common one you'll hear about is thoracic outlet syndrome. And one of the components of thoracic outlet is the first rib is elevated. And that first rib elevates because of forward head posture. So a lower rib, like I said, usually there's swelling in there. So you want to get adjusted. And then if we don't restore that lordosis, so the lumbar curve, the loss of the lumbar curve is a big part of why the ribs will be out of place. So I would recommend just, trying to find somebody to examine your posture, determine how much lordosis you have, how much work it might be to actually get that curve back into your lower back. But usually curve is not created or destroyed, just changes places. So when you lose your lumbar curve, it goes into an accentuated thoracic kyphosis, and then that draws the ribs out of place. So you want to get the total posture, the whole posture back into alignment. Brian, watching from Virginia, welcome. Welcome, everybody. Glad you're all here. Have any questions?
I have to go, we're coming in quickly. I have to go back a little bit.
Hi from Indonesia, Natasha. Hi, welcome.
Alexis, can you crack your wife's back?
Well, I just told him I just adjusted everybody.
Oh, maybe it'll crack again.
Mm-hmm.
Let's see. I don't know if this is going to work.
Kind of rotated here.
Just a live one. Here you go.
Excellent.
Oh.
Excellent.
There. Did you hear the cracking? I heard it. Show my table over there.
Anybody else want to adjust it? Get over here.
Fun. I cracked like twice. Okay. What? Brian is watching from Virginia. Did we say hi?
Yeah.
I heard a spine too outside,
Okay.
so I'm hoping it's okay.
I moved the gain up a little bit, so that might help. Do you adjust your family every day? A couple times a week. And then, or if they get injured, obviously, if they have any falls, Charlie needs to be adjusted a lot more, but he really doesn't like it too much. So
yeah, they start to like it more as they get older.
We do a bow cracking compilation.
Lemon. Hey guys, please make a bow cracking compilation. Okay, we'll have to do that. Yeah, tell us what else you guys want to see on YouTube. Yeah. Definitely give us some ideas. I don't know what that is.
It's a little bigger. There we go. Diagnosed with degenerative disc disease.
Where is it? So go ahead and say who it is and read it so
Erica
people know.
Asks, is it recommended to have adjustments when diagnosed with DDD, degenerative disc disease, with multiple herniation on lumbar? So you want to not adjust the areas that are injured, and that sometimes chiropractors get so zoomed in on the areas that are injured that they lose sight that there are other areas that are not injured. So it's most commonly people are adjusting the areas where the injured discs are. The injured discs are injured because of hypermobility. So we want to not keep adjusting the areas that are hypermobile. It further injures them. But you want to work around the areas that are injured. So yes, but specifically on the areas that have the herniations, I've never found benefit. And if anything, my dad was injured. People that I know have been injured previously by adjustments or manipulations on the injured area. So be careful. You definitely want to ask whoever who's treating you. Say, what's your goal with the adjustments? Why are we doing this? I have these injured areas. Why are they injured? I hope that any chiropractor will be able to defend why, what they're doing and be able to explain themselves. If they can't explain themselves, kind of red flag. What's the purpose of what we're doing? That was Devin. That was an awesome hug. It was a chiropractic hug.
It was awkward.
Actually, it was pretty awkward.
It was awkward.
It was pretty awkward.
I have to watch that back and be like, oh, that wasn't very pretty. Did you hear the crack though?
Yeah.
Did you? That's what matters. I felt it. So Halila is on here. Tropical hurricane. Where are you?
Your knee trick helps me so much where you sit. Or you sit on this side. Where you sit on the inside of the heel. Yes, very good stretch for your knee, A12. He only has one range of motion, so just bending it, getting that meniscus hydrated.
Aviana says, hi, how are
Oh,
you?
we're doing good, yeah. It's
Good. We're doing well.
really, really hot here in Florida. Other than that, AC is running all the time. The other day, the AC cut off, and I had to leave work early because we have these drain lines that drain the water condensation. Yeah, I knew she wasn't going to. I came home real quick. Clear this line out. I've been a huge fan of yours. Cartoon says, I've been a huge fan of yours for years, but I'm so far away to make an appointment. Fortunately, I'm moving to San Francisco for school, which is much closer than where I am now. Okay, well, hey, if you're ever in Florida, or planning on being on Florida, just call the office, leave a message. Our staff will get to you and try to get you on our waiting list. And, just please be patient. We do have a lot of people call in, but just leave a message, and we usually can respond to most calls, usually by text. So that's usually the best way.
So Devin, thank you for the.
Oh, Devin, thank you.
Thank you for that. Appreciate it. All right. Do you want to read that?
So Devin asks, have you ever accidentally destabilized someone's scoliosis curve as in pulled them over? If so, how do you fix it? So kind of a deep question. So there's two types of scoliosis, right? So functional and structural. So let's say it was a functional scoliosis, but I think more than 50% are functional, meaning that there's pain causing an awkward way you're standing or tilted. And then you take a picture. Most commonly, when are you going to take an x-ray? When someone's hurting. So you take a picture of someone that's hurting, they're going to be in antalgia. That antalgic posture is going to create a functional scoliosis. If somebody is adjusted in the area that's injured, creating the antalgia gets worse, their scoliosis will get worse. And I would hope that my adjustments and my care don't aggravate the injured area. Therefore, no, I wouldn't make it worse. Structural scoliosis are ones where the spinal column is not where you're actually too long. The spinal cord inside the spinal column is too short. And so the spine buckles laterally to alleviate spinal cord tethering. So there's usually a baseline to that we can reach with the ScoliRoll. Is a device designed by chiropractic biophysics. We utilize it on our sides, and we can use it to reduce scoliosis through stretching. So the adjustments are used to make the spine limber, clean, and then we use the stretching to reduce scoliosis. So the ScoliRoll, you can, I think it's SCOLI roll. You can Google it. It'll be on chiropractic biophysics website. You can kind of get an idea of what it is. It looks like a lumbar dental with a little bit more pinpoint, and you would use it. Scoliosis always goes right in the thoracic, left in the lumbar. So we call it dextro-levoscoliosis if it's a structural scoliosis. So it'd usually be right upper, left lower, you're trying to go what we call the high side of the rainbow, and we can reduce scoliosis through stretching. Stretching the ligaments is the only way to change a structural scoliosis. As much as I would like to say that we could adjust it out, it's not really possible. My dad would be the first to tell you that he's tried, and the only way to change it on an x-ray is by stretching. And then you can only really get it to baseline. For instance, I myself actually have a scoliosis. I have about a 19-degree scoliosis, and mine can be worse than it needs to be. If I call it feeding it, but we do things to keep it at baseline. Essentially, I'd be taller if I had my spinal column pulled straight, I'd be 6'3", 6'4". I'm 6'2". So I have to be 6'2" because my spinal cord inside isn't long enough. And so the spine buckles to alleviate pressure on that cord inside. So I hope that answers your question.
So you've never personally destabilized someone?
No.
Okay.
No.
Sorry, guys. Okay, I need to let's go back up so we don't miss people.
The audio is brutal. Oh my gosh, why? Check your microphone. I guess I'll just keep asking. If anybody's having trouble with the microphone, maybe we're having microphone issues. I'm sorry.
It was clear when I checked there, and other people said they weren't having them. I don't know what to do. It was cutting.
Yeah. I can always.
Layla's saying it's good for her. Maybe it's a distance thing. We're getting mixed reviews on the audio. Some people are saying it's fine. Other people are having trouble.
I turned the gain up a little bit,
Maybe
and I can mess with the settings on here if more people are having issues. Yes, I adjust people with scoliosis myself. I get adjusted 4 or 5 times a week by my dad. So I'd be Brian Lloyd. I'd be personally that person that's getting adjusted. SI joint mobility, 812 is asking. It's a difficult one. SI joint really needs to be worked on directly, or the side posture adjustment is probably the best way to mobilize the SI joint.
Is there an at-home exercise you recommend, like a stretch for SI joint mobility?
There is some exercise we can do for SI joint. They're not the best. The best is what I just described: adjusting or deep tissue work on the joint. You can lay on your back, lift your bottom in the air, lay a roller across the top of the SI joint, and kind of bring your knees up, rocking side to side along the crest of the ilium. Probably should make a video of that.
But if you have low back problems, can it irritate that?
Yeah, it's hard. The SI joints is difficult to work on without aggravating a lower back. So we got to be careful with you. That's why I like the pinpoint work, because we want to make sure that we're not hitting the areas that my son's making faces. Hey, big guy, you okay, bud?
Yeah, fine.
Okay.
Okay.
Jay's asking, Doctor, give me a thumbs up or down if I can come in the shop to be sized by one of your foam pillows on a belly side sleeper. I work with Jeffrey, not directly, but a different file. So yeah, just contact the office, and then we'll contact you through that. That'd be the best way.
Tropical hurricane. Hi, I'm glad you made it. We know that person.
Cool. Hey, tropical.
It's Halila.
Okay. Let's see here.
Oh goodness, our girls are being funny. They're commenting. All right, let's go. We're going too fast.
Andrew Slutz.
Oh, hi. Okay, is it? I want to say the name correctly. Anha? Is it Anha? I don't know if we know how to say your name properly.
You're more relaxed.
Hi, Carolyn. How are you doing now? More relaxed is Ed. Yes, thank you. Ed's taking great care of us and me. We do have a small update about what we've been going through. We can talk about with the stalker. I don't know if everyone here knows about the stalker. We talked about it in our last live stream. Instagram, there's some information there from the past as well. But yes, we're doing better. We're kind of having to jump back into things though, but we'll talk about that in a minute. Let's see. Just if you pick it, say the name.
Mhm. Natasha Cindy asks, what do you suggest if I have stubborn knots in the hamstrings? Overstretched the hamstring a couple weeks ago. Already seen a chiro, been treated, but still feel a knot if sitting too long with cross-leg. So right posture, right? So easy test you can do is just standing, and you can kind of put your hand on the back of your hamstring, move and shift the weight to your toes. You'll feel your hamstrings just get really tight. So a couple reasons why the hamstrings can develop knots is posture, forward posture. If you're sitting too long, when you go to stand, you retain some of that forward posture. So you want to get adjusted, get your ear over your shoulders, get your posture upright. Also, with the lower back, the nerves coming out of your lower back control the hamstrings. So when the lower back is upset, it can taser the muscles that are in your hamstrings. And so while sometimes if the nerve is alleviated, you might need to go into the hamstrings and actually release the knots. But many times calming the lower back down, getting the lower back healthy will make the hamstrings not be contracted and knotted up to begin with. So I would try to take stress off the lower back, support the lumbar lordosis, get that curve back in your lower back.
Is it Anja? Sorry, I'm Googling how to say people's names. Anja?
Anja Sloops.
Anja Sloops?
So Cartoon asks, have you ever had an appointment where it was the patient's first time being to a chiropractor, but you couldn't tell whatsoever because of how loose their muscles were? Most people that I treat on their initial visits are usually, their spines are more locked than loose. Probably something 90+% would I say they're usually head forward, right? So, it's like if somebody wasn't maintaining their own lawn, right? They're, the first time a lawn company comes to a lawn, it's going to be a mess. So, they're not going to have everything manicured perfectly. So first time patients, especially if the first time being to a chiropractor, it's like the first time they ever went to a dental hygienist, probably going to have some plaque on their teeth, right? It's probably be more unusual than anything for there not to be plaque on your teeth if you've never been to a dental hygienist. So, I think of chiropractic as a way to, I use the word clean. I know it's not a commonly, but I clean people's spines. The spine is cleaned through mobility. So when we're sitting primarily from 5 to 20, we lose our right posture, and then that creates, stiffness and then inflammation build up. What's up?
I'm just making sure this is connected with the mic.
We're good, yeah.
Okay.
Uh-oh. Is chiropractic covered by insurance? So it depends on the insurance. Okay, then. Okay, and then ask, is chiropractic covered by insurance? So it depends on what kind of insurance you have. There could be chiropractic benefits or not, meaning you have to go to somebody on the list that your insurance has subscribers, basically practitioners that subscribe to them, and they'd be on their network. They kind of have to accept whatever they pay. And then there's out-of-network providers. I'm not on any insurance list, so you'd have to have an out-of-network benefits for my office. They call that PPO is the other word for it. So it depends on the insurance. There's quite a lot of variety there.
Brian says the sound is better. Elena McLaughlin. Hi. Who is that? Hello. Who's that? That's our daughter.
Okay.
I think we've missed a lot.
Here it is. I'm not going. I'm going back.
Okay.
Do you have all the
Can you name the person so they know?
Okay. Opinionated senses. Do you all have a
Sense.
network of doctors like you? I can't find anyone in Missouri. Right. So it's like an art. It's like a chef. Every chef wants to cook the way they want to cook. Right. And what is it?
We don't have a network.
I'm not on a network. Sorry. There's my sister and my brother. We're in Florida also. My dad works with me. And it's kind of.
You could check out chiropractic biophysics idealspine.com. Now he does chiropractic biophysics. That's not the only thing he does those, but there are guys that do the corrective care, and they are chiropractic biophysics doctors. And if you go to idealspine.com and type in your location, it will show you if there's someone who has been trained in that technique at least. They might not do the massage or the soft tissue work like he does, but they at least have knowledge on how to correct the lordosis in the spine and fix your spine that way. That might be somewhere to start. Let's see. Oh, yay. I think we got it right. Anja. Anja? Did I say that?
Mhm. The beard.
Brian Cuss. How do you get your beard to look so good?
It's because the hair is leaving here and it's coming out here.
Oh, no.
It's getting fuller every day.
He used to not be able to grow a beard,
Yeah,
but now he can.
Yeah.
He used to, like, he never had one because he was.
it's like a cosmic joke.
No, you still have hair. It's fine.
It's now going in places that let's not talk about that.
Yeah, I don't. What do you do to your beard? You trim it, right? You
Yeah.
trim it. I don't.
Yeah.
You use beard oil. You
No.
don't do that. He
I-
just
I
is
am
very
very-
simple.
I have enough oil
Yeah, he just trims
naturally.
it with Avery, whatever trimmer.
Yeah. So Sean asks, are there any stretches you would recommend for sore trapezius muscles? You know, again, you know, kind of what the cause is. If you're exercising a lot, you know, you can kind of, when it gets some heat on some muscles, obviously, you know, if you have a lot of lactic acid in the muscles from exercise, then you want to rinse out the muscles, kind of gua sha them. I would be more massaging in the muscles from exercise. Then you want to rinse out the muscles, kind of gua sha them. I would be more massaging like a Theragun or getting blood flow in there would be the best way. If it's postural, right? So the trapezius are also integral in alignment. So if your head's forward, that's what's causing the soreness. You got to get the ear over the shoulder. You know, that's where alignment is mandatory.
Oh, look. Thank you, Opinionated Sense. Aw,
thank
thank
you.
you.
Yeah.
We appreciate that.
Thank you for the support. Thank
We
you.
see you comment a lot too. So thank you for your support.
Thank you, opinion.
We really appreciate comments and watches, you know, everything. So thank you. Should we do that?
No, I think my Wi-Fi connection's good.
Yeah, we're trying to figure it out. We're so sorry. We have good connection here and it's working here, but I don't. Is everybody having problems?
If anybody has any microphone, just
Let us know. Let us know.
I'm
We're
messing
trying
with the
to
microphone
figure
here.
it out.
Maybe it is
Should you
on.
put it back on the other setting?
I could. You try that?
Let me see.
Oh, wait. I
Well,
can change.
let us know and we'll try to fix
I
it.
looked up some settings for this Yeti microphone and I was trying to, they said this would be a better setting, less background noise, but if it's causing problems.
Did we skip people?
No, it's right here. We're good. I hope
Dylan Yates.
Hope the humidity down in Florida isn't too suffocating. It's pretty bad. We had feels like 115 the other day. 115 Fahrenheit, yeah. Used to live in Pennsylvania, so I know the East Coast humidity is something else. I'm now in Texas where it's dry heat, which isn't fun, yeah.
Yeah, heat's just not fun.
Yeah. Any tips for a new, so Amanda asked, any tips for a new mom with a sore mid-back and shoulders from holding baby so much? Wow, yeah. My wife, when she was nursing and you know pregnant, I worked on her all the time. It's difficult. And
I feel like you're in survive. See a chiropractor. Every time I got worked on, it made it so much better. Try to be aware of your posture when you're nursing. I know, but it's hard when you have a baby. You're just holding, so everything's rounded. So definitely I would massage. Chiropractic can really help you get through that stage because it's hard on your body. I don't know what I would have done without it.
So Bobby asks, do you work on people that have had neck and back surgeries, been going to mine over 30 years? I wish new school, but not. So I don't know what my percentage would be. I would say maybe 10, 15% of my patients have had some form of back surgery. You know, the surgery itself didn't address the reason for the surgery. So yes, a lot of my work is getting to the source of why that surgery happened. The areas that have the surgery are generally the ones that are abused, so they need to be left alone anyway. And so, you know, again, find a practitioner, ask them what they want to do. You know, hopefully they don't want to work on the areas that are, you know, if you've had a discectomy or a rhizotomy or a rod or, you know, a fusion or something like that, you know, leave that area alone.
It's from Jamie. We're trying to figure out why we're having problems. We have friends texting us with their ideas. I think we're having a delay with the internet, possibly. Do you want to check the connection upstairs?
I mean, unless
I'll sing and dance.
we're
with
on
you, Jack.
we're on Wi-Fi here, so
Is there anything we do
we'd have to change where we're streaming from for a better connection. Unless I
go
run.
upstairs? I don't think we can go upstairs. Our kids are up there. It'll be way loud. Not good.
Ice. Dawson asks, I hit my back today when working out. What should I do? Ice for 72 hours. Always get ice on things, and then seek a practitioner. Just skipped a miss in here.
You missed a lot.
I'm going back. You can replace the J.
Oh, let's see.
Oh, there's Anja.
So I replaced the J for a Y. So it'd be Anya. Anya?
Doing this one.
Anya, thank you. Dylan Yates. Okay, didn't know you had a stalker. Hope your family is safe. Thanks. Yeah, we talked about it more in our last live stream, and we've talked about it a little bit on Instagram. It's not something we don't know anybody who's gone through it either, and I think we haven't even heard of other people online who have gone through it personally. So it's been very strange. But anyways, we had a break from it. Our cases started to move again, so we're kind of hoping it will end soon, but we're back in court off and on this past month and next week to see if we're going to have some of it get resolved. So yeah, stalking's a real thing. If you head over to Instagram, you can find some more posts, a little bit more information about it, just what we've gone through. I don't know. We'll talk about it too, I guess, more eventually. Yeah.
So Vic Fox asks, you said for a chiropractor not to work on hypermobility areas. Slipped rib is a hypermobility issue, so chiropractors shouldn't work on it specifically. Right. The reason for why the rib goes out, it actually, when it goes out of place, it actually creates stiffness. So I understand kind of confusing because if it moved out of place, it must be mobile. But now that it's moved out of place, it usually gets frozen out of place. And so it needs to be, that area typically needs to be adjusted. You need to make the spine limber. The whole chest needs to become limber so that you actually make the posture better. So you're going to have some, and also need to squeeze out the inflammation in the joint. So that area, the middle back, almost never has surgery. T12, T11, you want to, seek treatment there would be my recommendation.
Some questions you can't fully answer because he's not there to diagnose you or actually examine you. We can give general ideas. So we're really sorry if we don't answer a question. It's usually because he can't answer it just for reasons that he cannot actually examine you. But sometimes we can give a roundabout answer, give an idea of what to do. But right.
Right. And you should always first seek treatment. I can try to give kind of general guidance on what I do in my office. But we want to,
if you're having a personal problem, we can't personally say exactly what to do, but try to point you in the right direction.
Gabriel asks, I have a question. I have higher muscle mass flesh on my left neck than on my right. Will this affect my posture if I don't try to even it out by training the right side of my neck? So you gotta, you definitely want to seek, somebody to check out your neck. Sometimes you can have vertebrae that are rotated that push the muscles up. So it feels like the muscles are thicker, or you have an injury on one side that's throwing the weight to the other side. So that's what's actually making the other side get larger, or there's a nerve pressure causing atrophy or weakness to the other side. So you can't really exercise an area where there's a nerve pinch that's making the muscles weaker. So if one side's more built up, it can be because that side of your neck is overstressed. So it's hard to answer that.
Go back up. Sorry. Jasmine, I have a chiropractor appointment tomorrow, and I'm honestly scared.
Don't be
my
scared.
First time. Aw.
Oh,
It's normal to be a
let
little
them know,
nervous. Let them know.
Yeah, let them know. Hopefully they'll,
Yeah. Tell them you're nervous and they should walk you through it.
Yeah.
Go slow, but you'll be good.
So sometimes, was it, I don't know how to say that.
RNTE.
Won't ask, when I wake up, my upper traps feel kind of sore. Why is it happening? Usually in the morning you get the report card for the previous day. So it can be either an activity to the previous day, posture, right? So, or even when you're sleeping, if you're a side sleeper, don't tell me you're a stomach sleeper. You want to be on your back, but even people that are on their back, the pillows, if they have too many pillows, pushing their head forward, that can stress your lower neck out. So when you're sleeping, you want your ear to be over your shoulder. You don't want your head being pushed forward. Side sleeping creates a tilt, right? So whatever side you're sleeping on, that shoulder elevates. Stomach would be the worst because your head's going to be rotated heavily. So it kind of work through those answers.
I go back up. Someone said, Crystal. Hi.
Hi, Crystal.
Hi. Wow. Do you want to read it?
Go ahead. You're right.
I'm not gonna be able to say your name correctly. How do you say that? Anastasios. I'm so sorry. I'm bad at names. Anyways, I was born at 21 weeks, 14 ounces, and I'm 26. 21 weeks. Wow. 14. 20, that makes 14.
Wow.
I am 26, healthy, and have a lot of joint problems, especially in my knees. What do you recommend me to do?
I have to examine your knee and to give a better answer to that. What kind of pain? Is it cartilage? Is it the alignment, right? So, it's hard to say without a full exam on your knee.
Probably should get checked out by somebody though. Anya equals
Vagabond, who else works in your office? We haven't met yet. No, it's just my father and I. Yeah, just us two. Yeah. My mom sometimes checks in every once in a while. But
we're getting ready to remodel the office,
Yeah.
the main office.
Yeah.
We have the back where we film remodeled, but
Yeah.
that's going to start in a couple weeks. So that's exciting.
Where's your clinic located? We're in Sarasota, Florida.
Go back up. We're missing people. Aquanda Evans, hello, Dr. Ed and wife. Love your show. I support all the SIBs. Aw, thank
Thanks, Aquanda.
you. Watching Brenda and Max too. Good. Thank you. Kurt Tunes. My name is Kyle, by the way. Thank you for the response. A visit with you is on my bucket list. Cool. The name I cannot say, Anastasios. Where is your clinic located? We're in Sarasota, Florida. Where are you located? Because I can't say your name. It sounds like it's a nice name though. Lucas, the future. Hi.
Hey. So Kepi asked, in your videos, you often work on the muscle between the spine and shoulder blade. I also have a raised left shoulder blade pain and dipped ribs on the left side. What is going on with this? It's, kind of multifaceted. That area is like a Times Square. A lot of muscle connections in there. A lot of reasons for why you can have pain in there. You can have lower neck dysfunction giving you pain in between the shoulder blades. The pec plays tug of war with the rhomboids, so you can have just pain from muscles, pain from ribs, pain from the joints in there. You can have nerve pressure in your neck causing weakness to the muscles that hold the shoulder blade in place. So, it's again, I wish there was a simple answer. There can be a lot of reasons for why there's pain in that area. The extremities are more simple. If you have pain like on your wrist, it's only so many things it can be. But when you have the spine, if you look at a nerve chart, there's just a ton of nerves, especially the nerves in your lower neck that can refer pain to in between the shoulder blades.
Thanks for doing the live stream. You're welcome. Thanks for watching.
So Lana asks, can chiropractor fix plantar fasciitis? So I find a lot of plantar fasciitis happens because the arch drops because there's too much weight on the toes. And I think most people can already know where I'm going with this. Why is there too much weight on the toes? Because we're all rounded forward and our posture is rounded forward. So getting people back upright alleviates the dropping of the arch, which then pulls on the fascia. So this fascia runs from the base of the metatarsus to the heel. So when the arch drops, it pulls on that fascia. So, want to get the weight on the heel. About 70-80% of your weight belongs on your heel. And when your weight rounds forward, or if you're sitting all day long or driving or back injuries, your weight shifts forward, the arch drops. Hence, you get that fascia being pulled on. So,
Can I see this?
what are
There's people texting me. Oh, look, Catherine says hello. Catherine,
Hey, Catherine.
hi.
Hey.
I'm looking for something. Are we at the bottom?
It sometimes automatically scrolls you back down.
Oh, okay. Our daughters her friends are being funny. Elena, did you like the buttered popcorn jelly beans? No, I did not. You know that. Do you like buttered popcorn jelly beans?
Oh, have you given them?
It's the Bean Boozled thing.
Oh,
No.
I don't think I've even had
Does
those.
anybody like buttered popcorn jelly beans out there? Because I don't. I don't think Dr. Ed does either. They're being silly. All right.
Devin, thank you again. What's worse than a hypermobile? What is worse, a joint that's hypermobile or frozen?
Good question.
Well, in terms of the medical world, are going to label, their answer is going to be the hypermobile, because it may not it's hypermobile, but that's usually where all the bone spurring is, the disc, what they call disc degeneration would be. So the areas that our surgery is performed on is going to be the hypermobile areas. So in terms of the medical world, now I would say that the hypermobile area is actually the healthy part of your spine in the respect that that's actually the functioning part of your spine, right? I would say that the hypermobile area is actually the healthy part of your spine in the respect that that's actually the functioning part of your spine, right? It's overfunctioning. It's hypermobile. It's doing not only its job, it's its job. So it's not bad. It's actually overstressed. So the frozen area is what I would consider the bad area. That's the worst area. But the frozen area isn't injured because it's frozen. It's not stressed. Doesn't have any bone. It's not damaged in the surgical medical sense. But I have everything kind of flipped. I know it's kind of the medical world's going to say L5 is where the disease is, but I don't really call it disease. Again, these are things that I'm working on writing, and I call it regenerative joint adaptation, not degenerative joints. So when a bone grows, it's regenerating in response to stress, right? So if you overstress a muscle, they grow. If you overstress your skin, you get calluses, right? Those are adaptations to stress. We don't call a callus on your skin a disease. We don't call muscles getting bigger diseases, but when a bone gets overstressed or a joint gets overstressed through hypermobility, it starts to grow. If you call that a disease, then you must call a muscle getting bigger disease, or calluses on your skin diseases. They're all the same thing. They're adaptations to stress. Your skin's saying, hey, you're going to keep digging ditches without gloves on. We're going to put all these calluses on your hands to strengthen your skin and make your skin tougher. It's not a disease process. But with the spine, the bone spurs, and then that's why it causes pain, and so that's what gets the bad rap. But the mechanical reason that bone grew is because of it was actually working, so it's not bad. So the problem was other parts were not working properly.
Here, I'm gonna look there.
Go ahead,
Because it looks like, if you want to say hi.
Hey, Lori. So when we say having problems logging into your YouTube, forgot my password. I'm watching you both.
Oh, cool.
Oh, thanks. Can you read this? Oh,
Oh, hi.
glad you're here. though.
Thanks
Thank
for
you.
reaching out here. Hello.
Yeah. Denise asks, how often should a joint make a cracking noise when it's stretched? I'm just thinking of my back. I bend backwards maybe once an hour during my desk job since I sit hunched. Each time my back cracks. So, I'd want to know where it's cracking, right? If you can, sometimes it's hard to tell, if it's popping in the typically overworked areas, then that might not be a good thing, right? If it's the middle back or the upper back that's clicking, I guess, I would try to do things to make you not feel the need to do that. right? Either change your setup, how you're working, your either Vera desk, or even sitting backwards on a chair, or putting something behind your back, right? So you don't feel that desire. You're like, there's all this tension in your back that you desire to alleviate. So I would, it's what the sound is just air bubbles from the joint, right? So it depends on which joints are mobile. Usually the most mobile joints are moving the most, and those are the ones that are releasing the air bubbles. Right.
I didn't realize she's been watching since you were.
Right.
I didn't realize she's been watching since you were. So we're saying hi to someone from
So
Instagram.
Lori, yeah.
Lori, you've been watching
100
since
subscribers.
what? Wow. We had less than 100. Wow.
Thank you for this, for being here.
Thank
Thanks for all the
you.
support. Thank
I'm
you.
just reading through this. That's awesome.
Yes.
That's so fun. Cool.
Yeah, lymphedema. I had a lady that worked at a dental office. She just sat all the time. She was fit, in her early 20s, like 20 or 21. So not, the typical person that you think would have lymphatic edema, but she sat a lot. And I think he crossed her legs a lot. And so both her legs were like, I would say considerable lymphatic pitting edema was what we do it. So you kind of press on the skin, and then you release. And then if you see that depression and it stays there, then we know there's lymphedema. Lymphedema is the clear part of your blood, leaks out of the blood into the interstitial, right? And you have lymphatics that are supposed to collect that fluid and then recirculate it back to your circulatory system. So if you're sitting, the iliac and femoral arteries in your inguinal groin area are crimped, which makes it hard for blood to get in and out of your legs. Especially if your legs are crossed, you're making it even more hard. So you want to address the reason for why it's happening, and then yes, obviously you can work on the legs to help flush the lymphatics. Devin asks, have you ever heard of a spinal column shortening for scoliosis treatment? I've heard slows progression down. So the spinal column, as you age, the discs make up something like probably about a third of the height of your spine. So, as the spine ages, doesn't have to happen, but typically you're going to have a little bit of. That's why people shrink as they age, because the spinal column overall is shortening from just the discs dehydrating. So that would release some of that tethering.
Have you heard of? Is that the surgery he's talking about?
I don't know. I don't think I've heard of any type of
You've heard where they stretch it, right? Where they try to stretch it straight.
Well, when they stretch a scoliosis straight, you're going to create tethering. So the brain, they took MRIs of people that have had their spines straightened, surgically, and then they end up seeing the medulla, the pons, the brain starts to get pulled into the neck. Not a good situation. Spinal cord tethering is what it's called. So not a good situation. Oh, thank you. Anya Slute's going to bed. Good night.
Good night.
Opinionated sense, I think it's our connection. It must be our Wi-Fi. So next time we do this, we're gonna have to try to run a wire, I guess.
I think she's having no problems, is what she's saying. She says, I don't know what this is
Oh,
happening for others.
so yours is working
good.
fine.
Okay, good. I'm glad. Hang on. How far back up?
I'm just going back up till
okay.
I find it. Batman snuggles to. I'm Batman. Why do I talk like this? Do I look like a police officer? Hi, I'm in Tampa, and I have been watching you and your sister for almost 2 years now. One day I will have to make the trip down for the first time. Yeah, contact the office. We'll get you on our list. Yeah, so if I worked on with somebody with dystonia, yes. Yeah, not good. Brian asks, dystonia is where, the muscles are, either most likely there's some sort of atrophy or either neurologically or nerve pressure or something, the spinal cord or brain, right? So, you just want to start with the spine, get the spine healthy. There's a lot of you free up the brain body connection, right? So the muscles, everything in your extremities, everything outside of the brain really has no intelligence. The brain communicates intelligence to the body through your spinal column. So this is where the chiropractic philosophy 101, get the pressure off the nerves that leave your spinal column, and then the body can heal itself. I think we got all the stuff we got there. Okay, we're going back down.
Fast.
I've already done.
Did you get all those?
Yep.
I can see you in the mirror because we have hi, the whole world just saw you.
So MGS for fascia tension, fascial adhesions. Do you think Graston technique or Rolfing could potentially work? So I took the Graston technique elective when I was in school. The way they taught it was much more mild than I would utilize. I don't know why they would kind of comb gently, and then once it got pink, they would tell us to back off. And I'm not sure it was a school environment, but I was kind of like, guys, this is where we start. Like they were putting up a stop sign where I would be saying, let's go. So it depends on the practitioner. Everybody's going to do it a little differently. But absolutely, yeah. The Graston and Rolfing are tools to, to get the spine to stretch, right? So it's a means to an end, and then hopefully over time you won't need it so often, so that you can actually your posture is going to be the key through stretching. The adjustments in Graston and soft tissue work are used to help get the stretching to be effective.
Say hi to Lily here.
Hey, Lily.
Hi, Lily.
From the east coast of Florida, our friends over there. Got some close friends over there.
Sophia, did we get hers?
Sophia Isabella says,
we will always support you. Keep working hard no matter.
Thank you.
Thank you. Appreciate that.
Vix Fox says, I was scared and still am when I go to, well,
He was talking.
yeah, just hopefully they'll calm you down. My benching personal record, it's been a long time since I can do a lot of push-ups. Something like 50, 60.
He doesn't.
I like calisthenic type things, my own body weight. I don't.
He doesn't have time to go bench press.
I want a balance of strength and flexibility. I know our world teaches strength and it looks better on the cover of magazines, but I think the people that I admire are people that are, a lot of their spinal flexibility is there. And sometimes a lot of the exercises that people are doing are at odds with spinal flexibility. So you end up, making your spine more rigid, which, it's not bad to have power too, but it's just a balance of power and flexibility. So I think the most I've ever benched, when I was benching, I was trying to always do like a set of 5. I always thought it was kind of odd when people just do 1 rep, but I think I did like 5 or 10 at 235. I think was the most I ever benched.
500.
No, 230, 235. I did maybe, but I only did the minimum of 5. I felt like if I couldn't do 5 reps, but that was a long time ago, so probably not as strong anymore.
Matthew Parsons, you want to read that one?
Matthew asks, I first watched Dr. Brenda, then discovered you, and now watch both you guys. Your videos are very relaxing and put me to sleep. Oh, thank you so much. Well, in a good way,
Oh, Jay, the roundabout in SRQ. Did you say that? The original roundabout. That's right. He's on the original roundabout. People try to stop before they get on it because they don't know how it functions.
It's called a traffic circle. It's not a.
It's not like what they're putting everywhere else.
It's about being around.
Roundabout.
It was a commercial. What was that for? It was like for I think it was like TomTom or something. One of those GPS. They had Star Wars. So you had Darth Vader doing the make right ahead. The Mad Yoda. Must you keep left? Keep left, you must. You're going to kill people with these directions. Sorry. It's 2 ways through life, laughing or crying, okay? That's how I am. I'm scared of all of it, but I'm no more. Jasmine is, I'm scared of all of it, but I'm more scared of the neck. I understand. Yeah, you want to hopefully be, everybody walks out of my office. Nobody, and then hopefully the chiropractor's adjusting the areas that aren't injured and can do things to help loosen you up a little bit before they adjust you your first time. Have you ever had patients? So Trippy asks, have you ever had patients report heart palpitations too? Yes. Yeah. Yeah. It's probably a more significant symptom that I would relay for heart health, heart palpitations. So those are where you're feeling your heart, beating out of your chest or skipping a beat or, abnormal rhythm. I would find that more significant. It's not abnormal for it to happen every once in a while, but if how frequently it's happening, you want to contact a practitioner versus just blood pressure. Blood pressure I know is often heavily, which it's a piece of it, but I think of it like a puzzle. You want to take all the information together and then look at a patient from the whole.
Janae.
Goes.
Totally skipped.
It goes sometimes.
Janae.
Go back up. Had my first experience with acupuncture about 2 weeks ago, and it really helped. I have my next acupuncture tomorrow afternoon. I'm looking forward to it. Cut after the acupuncture. That's awesome. Yeah. I have a couple acupuncture practitioners come to see me. Big fan of it. John
So
says.
John's, yeah. All right. John, hi there. Big fan of the channel. Speaking of which, bit of a meta question. Did I say that right? Meta. Do chiropractors on YouTube chat with each other at all?
I talk to my sister about
Well,
it.
he talks to siblings, but
Right,
nobody
right.
else. So maybe the other ones are talking to each other, but he just talks to his siblings. So I don't know what the others are doing.
Hector asks, all my joints click in general use. I often wonder what could be the reason for that. As soon as any joint gains a load, the joint will click with motion. Any cocktail thoughts? Again, the sound is just air bubbles. So be curious, if it's doing all the joints, is it due to, it could be a tendon clicking over a bone, right? So sometimes you roll your ankle in a circle, you'll have a repetitive click. That's not a joint that's releasing air. That's just a tendon guitar string moving over a bone, right? So repetitive clicking sometimes can be, or usually always is tendon. So if the tendons are tight, then that again is from posture. So sometimes you can have bad posture creating muscle tension, which then makes the tendons tight like guitar strings, and then you're plucking the guitar strings. So if it's not repetitive, I would look at balancing your spinal mobility so that you probably have parts of your spine that are frozen, parts that are overstressed. Oh, thanks, Angel. Your videos always give me comfort. They help me sleep. I appreciate all you do.
You gonna read Janae?
Yeah. So do you find acupuncture to be helpful along with regular chiropractic? Yeah, absolutely. Yeah. It's it's a great way to help get circulation. It stimulates the nervous system. I find acupressure is less time efficient, right? So acupuncture is very, very time efficient. You can get a lot of spots quickly, right? So you get a lot of stimulation of these acupuncture points. I think acupressure is better, but I only have two hands, and so you only can hit so many spots. So depends on what you can get. But I would a lot of these points, like there's one here at the corner, the one here. There's points that I would work with my hands. Stimulating the acupuncture points with my hands with pressure, but it's great. Yeah.
You should do a video of yourself getting it done.
Yeah. Sure.
Hello, I'm watching your video in Korea.
That's awesome.
I'm your fan. It's an honor to meet you live. Oh, nice to meet
Nice to
you.
meet you. Thank you.
Thank you for watching. Liquid Freeways. Love you guys. Thank you. Love you too.
Young Most Hated says, salute, Doc. You got people watching from all over the world.
Aw,
Awesome.
It is really fun. It's cool.
Not the actual thumb, but the thumb area.
Jasmine saying this.
The thumb area towards the wrist. Why can I move that back and forth, and why does it pop when I move it? So if it's a repetitive pop, it's that tendon. So there's a tendon that's tight in there, and so you got to try to get to the reason for why that tendon's tight. Scooter asks, I wrenched my lower back a year ago. My legs swelled a day later, and now I need to wear compression socks to keep the swelling down and help with the pain. A chiropractor can help with, right? So I don't know about compression socks. I get what you're trying to accomplish, but I'm not sure if it actually helps long term, right? So you're making it harder for blood to get into and out of the area, but the area past the compression sock, you need circulation. So you're reducing overall circulation in an area by putting a compression sock on. I don't know. I would try to get the spine healthy, right? So because your back was wrenched, you stop moving, and because you stop moving, now you have swelling. So let's get your spine healthy, and then the lymphatic edema will go down. But compression socks, I don't know. I have patients that use them. I probably should leave it at that, but I think there's better ways of addressing that than just putting a sock on. So Hector says, definitely not watching this from the UK. Perhaps you can stress the importance of sleep. Yeah, go to bed. It's about 9:30 p.m. here. Watching this from Singapore. Cheryl, thanks for being here. Hi, as parents, do you have any advice for handling emotional problems?
Oh.
I tell the kids.
No, you don't. You're good. Emotional problems. We try to be a safe place for our kids, that they know that they can come to us with anything, and we'll help them get through it, even if it's hard, even if they've messed up. There's so many reasons for emotional problems, right? So I think getting to the cause of what is causing the emotional problem. All of our kids, and I myself and you, went through stages where you feel more insecure, and some of it is a age thing that they grow out of and just need extra comfort during that time. So I would just say, make sure the line of communication stays open so that they know that they can always come to you, even if they've messed up big, and they know that you're a safe place to help them get through it. So
Gio Como asks, how many times a week do you prefer to see a patient? I'm in Ocala and would be a day trip to come to your office. The goal of my care is to teach my patients how to take care of themselves. And usually on the first visit, I can pretty well know how many visits I would need to be able to get you to a point where you'd be able to kind of brush your own teeth and take care of yourself. The minimum, unless you're a teenager, people are going to need at least 5, 6, 7 visits to get to a point where they've hung around me long enough that they know how to take care of themselves, right? So, depends on what's going on. Think of it like, taking your car in for service. If the car's got multiple problems, it's going to take more time than if it's just got, just need oil change, check my tires, rotate, simple fix, right? So it's, but the goal, generally, most people in my office, the people who live in Sarasota, by visit 8 through 10, I've got them, for most part, able to, carry on the care at home. They come in when they're unable to stretch, when they're having difficulty, or if they get injured,
Sophia, go back up. Hi, I think that's Italian flag, right?
Yeah.
Hi.
Steve says, I fell over today and landed funny. My ankle didn't crack or click. It popped around my Achilles area like an elastic band and went halfway up a calf. Yes, I would seek, again, I would have somebody check that out. I seek him help for that one.
Should we go to the hospital or just somewhere else? When in doubt?
So, just, again, without examining anything, you want to, determine if the tendon's okay, if the tendon attachment's okay, right? So the tendons dive into the bone, right? So the Achilles tendon is dives through the periosteum. And so if you avulse that or pull that off, or if there's a torn Achilles tendon, I don't know if I would go, you should definitely seek a doctor to check you out. I would probably start conservative if you can. If there's a doctor nearby that's more conservative, if all you have is a hospital, then I guess you have to go there. But
we already saw that one. Did we do this?
No.
Pat is from Charlotte. Hi. Welcome. All right, some people are saying connection is stuttering. I guess we're back up a little bit. Connection is smooth. It seems like it's different for everybody. We're so sorry. I hope it fixes. Do you want to read that one?
Art asks, I have muscle knots in the traps in my neck. Is electric dry needling or needling where they hunt for the muscle knot going to help me? Can't seem to find anyone who does what you do. Right. I don't know if I can speak personally on that. I would I would, seek deep tissue work. If you can find somebody to work on you, you can even purchase gua sha tools yourself. Get a gua sha manual to kind of go over how to work on your own muscles. Or, like I said, go on chiropractic biophysics websites. If you can, if there's no one nearby, I don't know what to say. It's hard.
Just jumped in.
Here we go. Got it.
Carlos, do you know anyone you can recommend in the Los Angeles area? No.
No.
Well, yeah.
Does he live there?
Yeah. No, I'm just kidding.
I'm not saying. I have a classmate that might live there.
But they don't.
It's very popular.
Dr. Abs, I believe, is in Los Angeles. And Ed graduated with him, but we don't know his technique. So I'm sure he's great though. They graduated the same class. we don't know them. We don't know them. He doesn't know him anymore, but he knew him a little bit in school. But I don't know if he's good anymore. I'm sure he is though. He graduated from Palmer, so he's probably pretty good. He's probably very good.
So Johanna asks, I'm watching from Nova Scotia and the connection is great here. What do you suggest for the best way to keep good posture from a chiro standpoint? So being adjusted and then, counter stretching. So we call it mirror image stretching. If you're spending a lot of your day bent forward, then your body will want to retain that posture. So you want to be loosened up and then counter stretch. What are the Moon Rabbit asks, what are the gravitational effects of the spine underwater? Could an underwater chiropractor for spine shifting be beneficial?
There's underwater chiropractors.
I don't know if I've ever heard of. I wouldn't see how it'd be detrimental, but it might be hard to do what I want to do.
Have you ever heard of that?
No.
I don't think
But,
we can speak
okay.
very well on that.
Watching from Honduras.
Yaredi Rodriguez. Hi.
Stay with us, Anya.
Don't go to sleep. Stay with us. Sorry, go back to bed. Maria sounds messed up. Sorry. Is that recent? How far back are we?
Not too far.
Some people are fine and other people are having problems, so I don't know what's going on. Do you want to switch it back?
I'll switch it back. See if that changes anything. I think that's where I had it last time.
Let's see. Where are we? Tercero. Can you say that? Tercero. Lugo.
Terciero, maybe? I don't know.
Tercero. Man, I love your streams. I wish I was from your country so I could get your treatment. Keep up the good work.
Thank you.
Oh, I don't know. We know him. He comments.
Hey, Jaskari.
Jascarl. Hey, doctor and wife. I guess I go to Dr. Ed for education. I go to Dr. Max to relax.
Okay.
Oh, cool. Yeah,
Awesome.
Everybody needs to go watch Dr. Max. He's great. Has Chiro to the Max is his channel. So if you aren't familiar, that's Dr. Ed's brother. And he is awesome. So go watch his stuff and subscribe to his channel. And then you'll be subscribed to Brenda, Ed, and Max. So what is that one?
Oh, Hector, thank you.
Thank you.
It says, I get great comfort from watching. It's awesome to hear your metaphors are always interesting to hear. I appreciate it. Thank you so much for the support.
Thank you.
Thank you. Kate says, there's a spot in my back my GP and PT can't identify. My chiro says state restrictions won't let them diagnose. Any idea what it might be? What can I do at home? Yeah, I need to examine you. I'm sorry. It's a tough one. Depends on what's going on there.
What state are you in?
Yeah. Lots of love from the Netherlands. Oh, Tanya. Yep. Keep following you and your siblings. Keep doing what you're doing. Thank you. Oh, yes. Rolling the ankle is one of them. Toes when...
Hector
says toes when tiptoeing, wrists when loaded, neck when sometimes quick as well. Right? It's tendons. Will the office remodel with healthy tissue?
Yes.
Yes, yes. Better than what was there. Thank you, Devin. Yeah, we're still live. Yes, Nehemiah.
Yes. Oh, thanks for the support.
Thank you.
Nehemiah.
Thank you.
Oh, he's time.
Uh-oh. I can go back up. We're almost to the bottom. So Hines asks, sorry, I didn't formulate the question correctly. I wanted to ask, what would you recommend for me to handle emotional problems? You know, one of the least medical ones is going to bed at a similar time, right? So you have cortisol, this is a stress hormone, right? So you want to kind of go to bed around a similar time. If you're, you know, that first around a half-hour window, you should be trying to aim for in terms of going to bed. And then the hour before you go to bed, you know, have music, something that relaxes you, you know, something you like. Don't watch anything stressful. We should watch this show called 24 with Jack Bauer, and yeah, don't watch it like before you go to bed. It's like you're all amped up, and so you want to do things to help you sleep. So if you're not sleeping well, then you're not going to, you know, that kind of to me begins with sleep. Meditation, you know, things that you can do to help calm your mind. It's multifaceted.
You got to figure out what's causing them to.
Mm-hmm.
If you got a lot of trauma, you have to deal with that. Counselors can help with that. Depends on where it's coming from. It's cutting in and out again. We switched it over.
It must be the Wi-Fi. It must be the Wi-Fi signal. Next time we're on a cable over here so we can have better signal. Sorry, everybody. The signal.
Sorry, it must be our Wi-Fi.
Our Wi-Fi connection must be in this part of the house. Must be a little weaker. So I don't want to mess with it while we're still live here. But next time we stream, I'll run a wire from our router, and then it'll be perfect. Sorry about that. Michelle asks, I'm tall, and when I stand a lot, I get a lot of back pain. What advice do you have for tall people and back pain? Right. So when you're standing, most of your weight should be on your heel, right? So if you're noticing that if you're having to work and bend forward a lot, right, that forward posture is what's going to cause all that back tension, pain. Certain parts of your back will be overstressed, and because you're taller, when we bend forward, we have to, you know, go farther forward than somebody that's shorter might have to. So, you know, getting adjusted, counter stretching at the end of the day. So you're bending with your knees, you know, trying to not, you know, bend with your back all the time. So try to squat with your legs, put the stress on your quads, your legs, your knees. And sometimes I'll even stand with my legs separated when I want to talk to somebody eye level, because you're taller, you kind of want to always be standing above them. So try to, you know, as best you can, you know, separate your legs, but not, you know, look awkward, but
Maria, what do you do in your own community besides YouTube to educate people that know nothing about chiropractic care?
I used to do spinal screenings in front of stores.
I used to go to stores and stand outside or inside and just talk to people about.
Hello, my honey. Hello, baby. Hello, my ragtime gal.
About chiropractic. I mean, we are active in different parts of the community. In what church, you talk to a lot of people.
It goes with me everywhere.
It goes with them, yeah.
Yeah.
We haven't done specifically any seminars for the local community at the moment, but he works full time, and we do the YouTube channel, and we have 4 kids. So we reach a lot of people just through those interactions at the moment.
Weston asks, hi Doc, love what you do. Thank you all for what you do. Quick question. Who is the oldest between you and Brenda? So Brenda is 16 months older. She's older. She was the boss growing up. Yes. We went to college undergrad together. She was 1 year ahead of me. So we did a lot of undergrad together. I went to Palmer before she went to Palmer. But yeah, so I've been practicing a little bit longer, but she's older.
the connection's bad.
Sorry.
No bling bling hockey. Hey from Canada. Love your videos. Thank you.
They're telling to make sure you're on mute.
Someone, Box Fan 91. Yeah, I have anxiety, so seeking counseling soon.
Yeah.
Yeah, counseling's great when you need to just get to the root of stuff or talk through stuff with someone. It helps a lot.
I think most people, I mean, if you follow Instagram, we have a baby we lost. And it was basically our fourth kid. We had an ectopic pregnancy, and that was pretty rough.
Yeah, we're actually tomorrow was the birth date
So it's a
and the death
4
of
years.
our baby. Yeah. We sought counseling for that because it was very difficult after losing that baby. So counseling is great. It's very helpful. Lead to healing, help with healing. Someone was saying, go back up one. Sophia, that's maybe
Yeah.
a good idea. Good idea,
Yeah.
Sophia.
Yeah. Next time we'll do that.
Devin, do you try to compare your chiro skills with your siblings to see who's better?
Always competing. Always.
Never. Jeremy.
Yeah,
Hey, I
yeah.
called, but you were off today. Yes, no
So,
work day.
yeah, you should get a text by our staff tomorrow, so just hang in there.
What should you expect? Have you been adjusted before? So if you've never been adjusted, expect it to be different than anything you've ever gone through.
We'll have a good time.
Yeah, have fun.
So Magical Light asks, watching you guys from Trinidad and Tobago. Thank you for educating us. Well, thank you for being
Thank
here.
you.
Appreciate the support. Thank you.
Art,
Oh,
sorry
thank
about
you.
your loss. Thank you. Appreciate it.
Yeah, it's tough.
Yeah. Charlie's our rainbow baby.
Yeah, he's going to be 3 in
September.
2 months.
September.
2 months.
Yeah.
2 months. A little over 2 months. Our fourth kid will be 3. Charlie's. Our Ethan's here telling us.
What's up, bud?
What's up, bud?
Oh, go to your
Aw.
sister's. You go to your sister's.
We'll be down here soon, buddy.
Okay.
Not much longer. Literally.
Mm-mm. I mean, I guess we could tell them. You want to tell them about
Yeah.
memberships?
Yeah.
Oh,
good.
I have it here. Okay. Well, you can tell them to start.
Yeah, we're going to be starting memberships here soon. It's going to give you access to, what is it?
Okay, yeah. So I guess YouTube does memberships. We've not done this before, but we're going to do just one tier, I guess. And if you become a member, hopefully this will go live or be accessible by the end of the week, if not sooner. But you'll get to have a loyalty badge next to your name and comments in live chat, custom emojis to use in the comments and live chats. You'll get to have a membership shout out. So he'll try to say hello to you when you are a member, and priority reply to comments when we see them, because we can tell that you're members. So we're going to start with that, and you'll see it up on YouTube again, hopefully by Friday, if not sooner. So we're starting that. Yeah. I mean, we've never done anything like that. I don't know. So we'll see how
We'll
that
see how it
goes.
grows. If it grows a lot, then we can even think about like member only streams. And
doing more, but we're going to
more
just,
stuff for
we'll
members.
do that to
We'll
start.
See how it goes.
Yeah. And then,
then we also-
we have merchandise.
Yeah.
We've got a couple designs, and we were hoping it would be done by now, but then we might change the designs. So
A
do
lot
you want
of-
to show them what we have? So
Sure.
I can show you one, but we're not probably keeping it because our daughter said it looks like a chicken wing. So I
We've
don't
been
know.
working on the design for the people's elbow. So we have a couple different. I think this one my wife actually drew. My wife's a phenomenal drawing. Look at this drawing she drew. It's really good.
not done yet. I'm not
It's really good.
No, I'm not showing them that
You got to show them that.
I'm not done.
It's not gonna show.
No, these are not the ones I drew. I'm drawing one because I can't. Well, first off, this was the symbol we were thinking about, but we're not sure if we love it. So we might let you guys vote once we have symbols up. We'll see. That's
Yeah.
one of them. But my daughter said it looks like a chicken wing. So now I don't know if we're going to use it. Anyways, this was designed. You guys like that? It's his elbow. Can you see it? And then I'm trying to draw one. I don't want to show you it yet though, because it's not ready. Anyways, it's not ready. I have to send it into an artist. So. No.
She's
Anyways,
really good drawing.
we're trying to have merchandise because we want to wear merchandise and we want you guys to wear merchandise. So, no. Chicken wing. Does it look like a chicken wing? It's, oh, you like that?
Oh yeah,
I don't, she said chicken wing. I got insecure. I don't know if we have
we're going through a
two.
couple designs.
We're going through
Up
design,
for
and then we'll
design.
show you guys
Yeah.
everywhere on Instagram and on YouTube and see, maybe we'll guys vote once we have two. We'll see. I like the second better. Yeah, well, this one's going to be here no matter what. This is a sticker. This is not going to be we're trying to get an elbow, but this is here to stay. And that can go on a shirt or be on a sticker. This one, we're just trying to get a main elbow look. But yeah, I don't know if I love it yet either. So we'll see. We're working on it. We were hoping to be done, but we're busy. So
4 kids. I mean, I work a regular practice, YouTube.
yeah.
It's
You
been
like that? I've been, Steve, that's a good idea. I've been elbowed. Yeah.
Mhm.
They like this. Good. We like this too. This is here to stay, but it's not going to be the main. We want like a symbol that people see it and then they know it's his elbow. But this is going to,
They
this is going
didn't
to
put
stay.
the, they didn't put the gray on. It's good.
The gray.
It's starting to get gray back here. The sticker doesn't have any.
Can't we stop aging? That would be nice. Can chiropractic make you stop aging?
No.
Oh, let's go back up. I think we missed some.
No. Let's see here. What exactly is posterior listhesis? And Michelle asks, and what can be done for it? You know, I've been doing a lot with anterior and retro listhesis, so that refers to the vertebrae that are not lined up. For people who don't know what that is, so there's ligaments that run on the front and back side of your spinal column that prevent the vertebrae from sliding forward and back. So there has to be a structure called the pars that's broken for that to happen. So it's essentially a broken back. And, you know, I've tried different things to try to, you know, if we want to try to reduce it, you know, through using orthotics. But at the end of the day, I think the most success I have with vertebrae that are back or malpositioned in that sense, because it's a broken bone, is to leave the area alone. I don't think it helps to try to. It's unstable. That's why it's slipped out of place, and any care directed on it, I find, can aggravate it. You know, but it's not an exact. You know, there's a little bit of, you know, seeing how the patient responds, but I've worked on enough people with it that my general gist is to try to just leave it alone. So it's kind of the reason for why it happened was because that area was overstressed again. So it's you know, you want to try to find the areas that are not working that allowed that area to be injured when whatever injury went into your spine broke the pars. It's called the pars interarticularis. So when that pars broke, that was because that area was moving, and so that now allows the vertebrae to slip out of place.
John, love your videos. Thank you. Thanks for watching. Healthy Fit, really appreciate all that you do. Thank you so much
Thank
for
you.
watching. Ines, thanks for the advice. It helped me a lot.
So Jasmine asks, also have a jaw problem one side. It feels locked sometimes. I have to pop it all the time. It causes pain when I can't sleep. Oh my. So the jaw and forward head posture are directly connected. So you want, you know, have someone take a picture of you from the side, you know, determine how much your ear hole, called the external auditory meatus, to be over the center of your acromion from the side, right? So the more forward your head is from your shoulder, it's going to cause jaw tension, pushes your jaw forward. Also, obviously, you know, if there's issues in your mouth or, you know, grinding issues, you know, TMJ can be from, you know, dental problems or stress. Sometimes people will clench, and that causes a lot of, you know, tension in there, and then eventually inflammation and popping in the jaw. So if you're grinding, or either consciously or subconsciously, you want to try to get to the cause for why that's happening.
Don't touch my art. Anya says Charlie is cute and
No.
as Ethan is too. Oh,
Don't touch my food. Says, any tips on safely stretching the hip sockets? I like the butterfly stretch. So your feet together, knees apart. It's kind of it does the opposite of what sitting does to our hips. So you want to open up the hip socket. The hip socket is kept clean. We're talking about the femoral acetabular joint. I know some people think the SI joint, but I think you're probably referring to the femoral acetabular joint. And so range of motion is what keeps that joint clean. Safe self-cracking? No, don't do it. I think she has a good Instagram reel of don't do it, don't do it.
You can pull your fingers, right?
Well, right. Safely traction them. Ooh.
I like the first one. Looks like a check mark. Okay, everybody. We're gonna have to let people vote because we are not gonna know what to do. We'll design a couple and put them out there. Besides, but I think it's cool. I mean, it's cool.
It looks like a check mark made from chicken. A chicken mark.
A mixed chicken wing.
It's a chicken.
I get it. I see it.
All right.
I don't know. People think it's a chicken wing.
Ed McChicken wing.
That's funny, Devin. Second one. Yeah, this is so
All
we're trying.
right.
This is going to be here.
Yeah.
But we're trying to get a main just his elbow symbol. It looks cool. We did a T-shirt with it, and it looked cool on the T-shirt. But it's definitely. Maybe we can add muscles besides that. It does look like a chicken wing. It does. We're gonna not use that one now.
We should do these live streams more, just preview for our small audience here. You guys can be like our test audience for. No, I just.
I love it, the chicken wing one. Oh, that's funny, Jasmine. That's a good question. All right, yeah, maybe a couple more. It's NerfNet. You say not to use a dinner roll without chiropractic oversight. What about the dinner roll pillow?
You can use the dinner roll pillow. I think you can actually purchase it without going to a chiropractor. I think you can go on the website and get one. So yes, you can use the dinner roll pillow. The chiropractic biophysics that makes them allows people to buy them without obviously seeing a chiropractor. So yes, I would obviously, I think it works better if you're adjusted, if your spine is loosened up, and then you can, hopefully the chiropractor can go through how to use it a little better and some tips, with, more personalized to you. So, yeah.
James, did you watch Sound of Freedom? We haven't yet.
Yeah.
We heard it was,
I think my parents saw it.
Yeah. We heard it was good
Yeah.
and we would like to see it. Did you watch it? Did you like it?
I know. She's got it over there. I can't. I want to see it too. It's really good.
It's not done. It's not okay. It's not done
It's
though.
really good.
The hand is not done. It's not really good, and I just want to send it to someone so they can make it better.
This.
No.
My hand drawings look terrible.
Okay,
Do
I'm
not-
going to show y'all, but
Do
it's not
want to be
done.
Pictionary with me.
It's not done. Okay, so I'm trying to figure out his hand's not done. Something like that. That's my rough draft, but I'm going to send it to someone to
She
make
sketched
them
that
do
like
it.
like a minute.
That's something like that, maybe. But I'm going to send it to an artist who will make it better. The hand is not done. Once again, there's no
Yeah.
fingers on
Oh.
it or jaw or knuckles,
How is
jaws.
I mean, maybe I'm just easily impressed because I just
Well,
have
you can't.
zero.
He can't
I have
draw at
zero
all.
drawing abilities.
He can't draw.
Yeah, don't. Pictionary.
Joe.
Don't be on my team.
Ricky. Oh, that's very nice of you to say. Jasmine. Oh yeah. Okay. Thank you. All right, NerfNet. Thank you. I love your videos. Watch them every day. Thank you for
Thank you so much for
watching.
watching, everybody.
Eamon, hi y'all. I think we're almost to the bottom.
Never injured anybody. Connor McLaughlin. Nice last name, by the way. Have you ever accidentally
Are you a
injured
relative?
someone? We're all
Are we
relatives. We're all
related?
capable. Come from the island. No. So yeah, we don't injure patients. That's like rule number one.
What was that at the bottom? Oh, thanks. Eamon 1256. Hi y'all. Hi. Angel,
Yeah.
you are very creative.
Yeah.
Thanks.
She's good. She's good.
Well, I figure if I give someone an idea about what I want,
Yeah.
they can make that better. That's my goal.
She was really good at horse drawings. I mean, she loved her horse. But it seems like when I was dating her, she had like you drew this. Her mom draws a lot.
My mom's better than me. Yeah, she's
Phenomenal.
awesome.
Phenomenal artist.
Very good. Ad sensor. Are we back?
Sometimes bad. How long have I been a chiropractor? I
Connor.
started in June of 2007. That was I started working with my dad. Yep. Yeah.
AR Arts.
Yeah.
Awesome videos. Thank you. Joanna.
Contact.
I like the one where you, okay, thank you. I'm thinking I like that better too, because this one looks like a chicken wing and I don't want to be known as McChicken or what was it? I'm not so sure about that.
All right. Well, thank you everybody for being here.
Yes.
We had fun.
Oh my gosh, Anya, go to sleep.
Yeah, go to bed.
Go to sleep. All right,
Thank you for
Kimberly,
joining
I
us.
love your videos, Doctor. I'd watch
Yep.
them often. Great. Oh, thank you for watching. All right, well,
Thank
we're
you.
probably gonna, we're
Cool.
gonna probably get ready to go too. But we'll do this again.
Thank you for everybody's
and
support.
yeah, keep commenting or any ideas. We don't need Ed McLaughlin. I agree. That's funny. Thank you.
All
All
right.
right, guys.
All right. Have a good night. See you later.
Oh, bye.
Bye.
Sorry. Bye. Ed